Good evening and welcome to our COVID-19 update. I'm Ladi Akiridunduale. Here are the highlights at this hour. Presidential Task Force on COVID-19 submits report on proposals for Phase 3 of the eased lockdown to President Muhammadu Buhari. 3 thematic areas in focus. Non-compliance with COVID-19 safety protocols for interstate travel in Kano, as authorities say number of cases in the state has reduced. U.S. state of New York to introduce quarantine checkpoints at key entrances. Over 4.7 million people have now been infected with COVID-19 in the United States. We begin in Abuja, where President Muhammadu Buhari has received a briefing from the Presidential Task Force on COVID-19 at the State House. Members of the task force present included the Secretary to the Government of the Federation and Chairman, Mr. Boss Mustafa, the Minister of Health, Dr. Osagi Ehanire, the NCDC DG, Dr. Chikwe Hakyozu, and the National Coordinator of the PTF on COVID-19, Dr. Sani Aliu. The task force submitted its report on the last phase of the eased lockdown to the President, along with some recommendations which the chairman of the task force says the President is yet to assent to. He says this is why it is premature for him to discuss the details of the report. The enforcement of sanctions for non-compliance to COVID-19 quarantine regulations remains one of the major challenges facing the PTF on COVID-19 in its battle to flatten the curve of the pandemic. But speaking after the meeting with the President, Mr. Mustafa says that the recommendations are driven by the 3 thematic areas of movement, labor, and industry, as well as community activities. As the country continues to reopen in its 3rd phase of eased lockdown amidst rising infections and death from the pandemic. The PTF chairman is asking sub-nationals to ensure enforcement of quarantine regulations.
Like I've consistently maintained, the federal government doesn't have any mobile court. It's the responsibilities of the sub-nationals. And most of them have signed the quarantine laws in their states. And within those quarantine laws, where they have prescribed penalties for appearing in public spaces without masks, there is a sanction. It's the enforcement that has largely been lacking. And my appeal is that the subnationals should ensure enforcement. As a matter of fact, when we listed some of our challenges, that was one of it. It was top. Lack of enforcement of even the regulations that have been put in place as a result of signing the quarantine regulation. It's a regulation, it's a law. But you see, the issue of enforcement has been lacking. And it's not only in this area, in so many areas. And like I keep saying most times, that COVID-19 has exposed the weaknesses of our systems. All systems, not only the Nigerian system, even the American system, its inadequacies, in spite of its 300 years of democracy, have been exposed by COVID-19. If not, how can the president be arguing with the mayor of a city as to who has authority over what happens? It means that there is a big lacuna, there is a big gap in even that system, as all as that system is. So I believe that if we can just work on the enforcement aspect of it, which is the responsibility of the subnationals, we would go a long way.
Meanwhile, the federal government says the health and safety of all Nigerian citizens is the priority of the Buhari administration, as it intends to examine every possible option in the development and distribution of a vaccine against COVID-19. Vice President Yemi Osinbajo disclosed this today during a virtual meeting with representatives of the BNT162 COVID-19 vaccine candidate on the progress of the vaccine development around the world, including in Africa. In a statement issued afterwards by the Senior Special Assistant to the President on Media and Publicity, Laolu Akonde, the interaction was between the federal government and the promoters of the vaccine candidate, where Professor Osinbajo added that it is an important conversation and it is one that is prioritized as the largest country in Africa for the distribution of the best COVID-19 vaccine when it is eventually ready. The meeting was also attended by the Health Minister, Dr. Osage Ehanire, and the Executive Director of the National Primary Healthcare Development Agency, Dr. Faisal Shuaib, with representatives of Pfizer and Biotech, the international pharmaceutical firms promoting the BNT 162 vaccine candidate. In Adamawa State, Governor Umaru Fintiri has ordered local government chairmen to establish a 24-hour healthcare facility in each of the 20 local government areas of the state as part of efforts aimed at containing the spread of COVID-19. He gave this instruction in Yola during the distribution of medical supplies and equipment to the local government areas of the state. According to the governor, the distribution of these palliatives demonstrates his government's commitment towards providing quality health care to the nooks and crannies of the state, as well as preventing the spread of COVID-19.
The rise in the number of COVID-19 positive cases has been of concern to both the federal and state governments. In Adamawa State, no case has been reported in about 3 weeks, but now the state is suddenly recording an upsurge in the number of positive cases. This makes this donation of relief materials by some international development partners in collaboration with the Adamawa State government quite timely. The distribution of these medical supplies and equipment for improved primary health care service delivery in Adamawa State informs this gathering. Lined up for distribution are 20 items, which includes foot-operated hand-washing equipment, non-contact sphygmomanometer, autoclaves, stethoscopes, among others, are expected to be shared in the 21 local government areas of the state.
The ongoing COVID-19 pandemic.
The Adamawa State Governor Maro Fintiri says the items will address the gaps in the health sector.
This flag off of the distribution of hand washing, hygiene, personal protection equipment, and essential supplies to over 403 health facilities and health institutions address some of the notable gaps. This will ensure safe spaces in health facilities for healthcare workers and their patients.
We are distributing 52 to 72 per LGA. Some LGAs have 16, some 10, some 12. So the number is depending on the number of LGA, but we are supplying at least 3 per health facility out of the 403 health facilities. And we supply like 2 to some health training institutions so that they can use to practice hand washing and hygiene.
The distribution of these items is aimed at strengthening referral mechanism for the existing primary healthcare systems in the local government areas. Some of the agencies responsible for the donation includes the UNICEF, the National Primary Healthcare Development Agency, National Health Scheme Insurance Program, and the World Health Organization. They say these items should be used for the purpose for which it is meant to serve.
Following the massive sack of pilots and engineers by Bristol Helicopters, as well as Air Peace Airlines, the National Association of Aircraft Pilots and Engineers, NAPE, has asked relevant agencies of government to intervene in the matter in 2 weeks or face a withdrawal of industrial services by these personnel. At a press briefing in Lagos, the national president of NAPE, Mr. Abednego Galadima, also asked the Nigerian Civil Aviation Authority, the NCAA, to immediately ground all activities of Air Peace and Bristol Helicopters over the sack, as the action did not follow due process.
If call for the airlines to retract, that's to go back to pre-COVID salary so that they will be negotiated and resolved amicably. And we are calling on government to release the palliative. We are also asking NCA to make sure that some of these airlines that are airing, they should be called to order. If they refuse, they should be grounded. But most importantly, we are giving them 2 weeks for the relevant government agencies to intervene. Ministry of Labor, Ministry of Aviation, NCA, and NAPE, National Assembly, and the federal government, to quickly intervene in the industry before it is too late. And we are going to go on strike after 2. If nothing is done within 2 weeks, we are going to call on all aircraft pilots and engineers in the industry to withdraw their service.
In Ekiti State, Governor Kayode Fayemi has recovered from COVID-19, and he says Nigerians have lessons to learn from his experience. He also speaks about random testing in schools. Let's have the details from our correspondent, Babajide Agbeyo.
The governor of Ekiti State, Dr. Kaode Fayemi, has thanked Ekiti people and Nigerians for their prayers and good wishes during a period of isolation and treatment. But he describes his experience as one Nigerians should learn from, stating that anyone can be infected with the virus.
The fact that I could contract the virus in spite of the conscious effort to protect myself and people around me underscores my consistent warnings that we should never take things for granted. It also proves that indeed the virus is real and here, and that it is a respecter of no persons. That is why I have always maintained that we cannot be vigilant enough until we have collectively come to the end of this pandemic. I therefore implore you, dear compatriots, to take extra measures to ensure that you keep yourselves safe.
Secondary school teachers resumed in Ekiti State on Tuesday, ahead of the final examination for their final year students. The students themselves will be resuming next week, Monday.
I have directed that random samples of some of the students and teachers who are resuming should be taken for a test so as to be able to assess our risk level. This is part of our effort to ensure we do not have a spike after resumption.
Governor Fayemi demands vigilance from Ekiti residents to keep the rate of infection under control as the state is exposed to some neighboring states with higher rates of infection. Babajide Agbeyo for COVID-19 update.
From Ekiti, where we thank Babajide Agbeyo for that update, we go to Bayelsa State, where healthcare workers have downed tools in Yenagoa over a lack of basic packages. Dobra Timiwood has more.
The commendable efforts made by medical practitioners in Bayelsa State to curb the spread of the virus may be in jeopardy as the coalition of medical professionals and associates have begun an indefinite strike in Bayelsa State. Now, this coalition is made up of medical doctors, pharmacists, nurses, medical laboratory scientists, and other health professionals. They are demanding for the payment of their COVID-19 allowance from the Bayelsa State government. We spoke with the NAPE chairman in the state, and here is what he said is their demand.
We have been in negotiation and discussions with the Bayelsa State government for three key issues. One, proper placement of doctors in the employ of Bayelsa State government. And two, COVID-19 hazard and inducement allowance. And three, payment of rural posting allowance to the consultants that are working in the Niger Delta University Teaching Hospital. Our position is that COVID-19 is not selective. It affects everybody in Bayelsa State, whereas the federal government has paid our workers in Bayelsa State, that's in the Federal Medical Center, at the rate of 50% of basic for all the doctors.
This is the COVID-19 isolation center in Yenagoa, and the place is already looking deserted. Now, it will interest you to know that there are two strike actions going on concurrently. That of the NMA, which is indefinite, as they have three demands. Apart from their COVID-19 allowance, they are also demanding for proper placement of doctors and rural posting allowance. Then that of the coalition. Now, they are saying if the Bayelsa State government does not respond to their demands, then the fate of those that may be COVID-19 positive in this period would definitely not lie on their hands. From Yenagoa, Dobra Timiwood for COVID-19 updates.
Thanks, Dobra. Moving on to Yobe State, where the government there has asked students of Senior Secondary School SS3 and Junior Secondary School 3 in the state to resume academic activities on Saturday, August the 8th, 2020. Briefing journalists in his office, the Commissioner of Basic and Secondary Education, Dr. Mohammed Idris, says government has put in place all necessary safety measures to allow a hitch-free resumption. He explains that boarding students will resume on that Saturday, while day students are to resume on Tuesday, the 11th of August. Dr. Idris says fumigation of both public and private schools is ongoing in order to meet up with the resumption deadline.
I feel glad and excited because we have been at home for long. We have been sick and tired of staying at home. No school, no learning. Even the online learning, we don't understand it that much. So I've been waiting for the day we are going to resume school.
We are happy the federal government at last opened the school. And as you can see, you see all the measures we are putting in place because of the happiness, so that we put the school in order for the children. And if you enter class now, you will see that the children have even started receiving lessons.
We came as a teacher here in the school, but we're waiting for the state government to give us permission to open fully, so which they promised.
Yobe to Kano State, where the major motor parks in the metropolis, amidst the lifting of travel bans since the start of the COVID-19 pandemic, has made those parks very active, with passengers traveling to different parts of the country. Channel's correspondent Vincent visited some of those motor parks to re-monitor the level of compliance to lay down measures aimed at preventing the spread of COVID-19.
Passengers are seen trooping into the Kufar Mata and Angwan Oku motor parks, boarding vehicles to different locations across the country. Although there was no form of social distancing seen, with few people wearing any form of face mask, businesses seem to be going on as usual, with caution thrown into the wind. Workers at the park applauded the government's efforts, but noted that enforcing the COVID-19 guidelines is not as stringent as when it started.
At the beginning of the coronavirus, they provided us with sanitizer, which every passenger has to sanitize himself before going into the car. And secondly, before entering the gates, at the beginning of the corona, they used that thing like gun, that thing that usually used in measuring temperature. They use it to sanitize the temperature of every passenger before coming into the park.
Kano State Government is optimistic that they have been on top of the situation, as recorded cases have remained on the decline.
The Kano State Government is winning the battle. We are winning the fight against the dreaded COVID-19, because at the initial stage we had high number of positive cases, but now we are into community testing, and that we are having thousands of samples to be tested. And then out of those thousands of samples, we are having very few positive cases. And then our discharges, the number of discharges from our home-based care and from the hospitals, they are increasing. So we can say that we are winning the battle.
Although Kano State motor parks do not seem to be in compliance with the COVID-19 preventive measures, the government is working tirelessly to curb the spread.
We'll take a break now in our COVID-19 update. When we come back, we'll bring you the very latest in the stats and figures of the situation with the pandemic in Nigeria. Please stay on with us. Welcome back to our COVID-19 update. The National Universities Commission says preparations are in top gear to reopen the nation's universities after the forced closure due to the COVID-19 pandemic. Addressing a news conference in Abuja today, the Deputy Executive Secretary of the Commission in charge of academics, Dr. Sulaiman Ramon Yusuf, says the Commission is collating data on the level of preparedness of the various universities through their vice-chancellors to determine if they were safe for resumption to both academic and non-academic activities. Dr. Ramon Yusuf adds that efforts are ongoing to resolve the strike by the Academic Staff Union of Universities, ASU, that threatens to further delay the resumption of academic activities in the universities.
Not less than 32 universities across our university system are involved in different stages of research endeavors that are aimed at galvanizing Nigeria's research, innovation resources towards the development of possible vaccines and, of course, non-vaccine related solutions to the ravaging pandemic. Other ACs in the university system that own testing and screening centers as of to the 2nd of June this year, because there are many more that are coming on board in this regard. Those that have been captured as of 22nd of June include screening centers at ABU Zaria, Bayero University, Kano, the University of Lagos, University of Benin, University of Port Harcourt, and the University of Jos. It is noteworthy that the way the ACEs have been found readily responsive and useful to mitigating the COVID-19 pandemic demonstrates how the Nigerian university system can be effective and relevant to national development if research is valued and adequately funded.
The Nigeria Center for Disease Control announced 14 deaths last night from 7 states due to complications from COVID-19. These states are Taraba, where there were 4, Edo 3, the FCT and Ondo had 2, while Adamawa, Osun, and Plateau states had 1 each. Testing nationwide has now scaled the 300,000 mark after 15,088 sample tests were recorded, inclusive of a backlog in the last 1 week. This comes as the country continues to record relatively low infections of the virus, with the NCDC announcing 304 new cases last night. Same figure recorded on Monday, apart from the 288 cases yesterday, the lowest since June. The latest cases were recorded in 18 states and the Federal Capital Territory, which has 90 of the new infections, followed by Lagos with 59, Ondo has 39, Taraba 18, Rivers 17, Borno 15, Adamawa 12, Oyo 11, Delta 9, Edo 6, Bauchi, Kwara, Ogun, and Osun 4 each, Bayelsa, Plateau, and Niger 3 each, Nasarawa 2, and Kano 1. With the latest figures, the total number of confirmed COVID-19 cases in the country stands at 44,433, and 31,851 patients have been discharged. Let's talk now to Dr. Blossom Madra, a public health physician. She joins us via Skype from the Lekki area of Lagos. Good evening, Doc. Thank you for your time. Welcome to the program.
Good evening. Thank you so much for having me.
Is it time for us to be quite positive about this? It seems as if the news is that the case numbers are dropping. We've had a fairly consistent drop in numbers over the last couple of days. Are we finally getting to where the curve is coming down, in your view?
Okay, so what we would advise is for us to be cautiously optimistic. And while we're being optimistic, we need to also look at what has happened to other countries like Japan, countries like Australia. Their cases came down, people relaxed, people basically began to say, oh, this thing is over, we're good to go. And then they started seeing another spike in cases. So we need to be extremely careful. While we're being optimistic, we need to remember that every single thing that we did during the lockdown, even during the easing of the lockdown, the mandatory wearing of face masks, these things have to continue, because if they don't, we're going to see another spike in cases.
Well, some of the things that we have been doing or that we were doing during the lockdown, I think there will be those who will argue, of course, that because we are easing the lockdown, earlier today, the PTF, that's the Presidential Task Force on COVID-19, submitted its report on what it wants to do for phase 3 of the eased lockdown. Now, churches and mosques are reopening, schools are reopening, restaurants are going to allow dining, and so why do you think people should remain cautious when all of these things tend to give us the impression that we're returning to normal?
So basically, this is the exact reason why we need to be cautious, because we're opening up the economy. So schools are opening, churches are reopening. So what does that tell you? That means there's going to be more contact between individuals. And this virus craves contact between individuals to be transmitted. So we cannot rest on our laurels and say, oh, we've beaten this, we're good to go. We need to, again, I repeat, we need to look at what has happened to other countries. And this, even Israel, as soon as the schools were reopened, they saw a huge spike in the cases. So we need to bear this in mind as we reopen. And we also need, on the other side, we also need to remember that we as a country, we're not testing nearly enough. So we're not even capturing all the cases that we currently have. So there is no time for us to say, we're done with this, we're good to go. We need to still be extremely cautious.
There's 2 points that I want you to talk about in a bit more detail, which is the issue of testing and then the whole idea behind compliance. First, let's take the testing. You say we're not doing nearly enough testing, but what that may have done is to give us the impression as if we've managed this properly. If out of 300,000 tests, we've got 44,000 cases and only 800 and what, over 800 deaths, there are those who will look at those numbers and say that this is very limited for a country of 200 million. Can you again reestablish that nexus for us?
Okay, so the good thing, I mean, it's not a good thing. Case fatality rates are never a good thing. But the good thing is our case fatality rate is quite low compared to other countries. So basically, the number of people the number of lives that will be lost out of all the confirmed cases. So that's a good thing. We seem to have a lot of asymptomatic cases, which is why a lot of cases are not reported. People sit at home. In fact, people actually call me and they tell me, you know what, I'm convinced I had COVID. I had all the symptoms, but within a few days I was fine. So we have a lot of asymptomatic cases. So it's not that we're managing, we have a handle on the way we're managing it. It's just that this virus has played out differently in our environment compared to other countries.
Now, when we talk about that, and again, before we go down, I know I said we're going to talk about testing, and then we're going to talk about compliance. But before we go to the compliance angle, you mentioned something very interesting there, asymptomatic cases.
Yeah.
The asymptomatic cases don't know that they have COVID most of the time. And
exactly.
They act as vectors, right?
Correct.
And they an ever-present danger, even when we think we have gotten a handle on all this, especially as we are easing down the lockdown. And as you pointed out, more and more contact will be between people at different places and at different times.
Exactly. You've exactly hit a very, very important point. Because the asymptomatic cases, they don't know that they have it. So they're going around transmitting it to everyone. So that is a big problem. And that goes back to what I was saying at the beginning. We cannot relax at all because this virus craves contact between individuals. So someone is moving around, they don't know they have it. The problem is people that have underlying conditions, the elderly, that these people come in contact with, and these people can actually die from this infection. So we cannot relax at all because we have a lot of people moving around us that have this virus transmitted it to people and they have no clue.
Let me bring you to the issue of compliance. One of the reports that we had tonight came in from Kano, where we took a look at interstate travel. On the day that most states were allowed to start interstate travel, there was a lot of attention and there was a lot of spotlight on the motor parks. So it seemed as if everybody, there was a high compliance level. There was a lot of checking. But when we went back in the case of Kano, the report indicates that the compliance level is next to nothing. All that has been dropped off. Now, if we take that as the situation in some of the states, Kano, of course, is one of Nigeria's big states in terms of population. So if this is happening in other places, such as Lagos, Abuja, and a number of other high population places, that's another spot. and yet that is an issue about compliance.
Exactly. Exactly. So it's, to say the least, that is very concerning, because of course the protocols were laid down, all the procedures that were supposed to be adhered to, sanitizing the buses, mandatory wearing of masks and everything was laid down. But within a few days, people just sort of threw caution to the wind, and everybody is basically going around doing what they want. This is actually where, so we need to have a two-pronged approach where we have enforcement. Enforcement is, there's no way we can do this without enforcement. And then on the other hand, we need to engage the transport unions, their leaders. We need to engage them so that they can get the buy-in of their people. So that when we're saying, oh, everybody that comes into your vehicle has to wear a mask, you have to be at 50% capacity, they understand why we're saying these things. So compliance is key. There is no way we can get things done without compliance, but enforcement has to go hand in hand with compliance, hand in hand with community engagement.
I must bring you to one of the issues that everybody is vexed about. Let me use that phrase. Everybody has a view on it, and it depends on who you talk to. And this is the issue of schools. Whether we like it or not, now they're reopening. Some reopened yesterday, some did on Monday, some did it today, some will do it next week, and at various levels. Do you harbor any fears that, as you said in the case of some other countries, that this might lead to a spike? And what do we then need to do, since it's a fait accompli that they will open, to guard against this becoming that?
So I've said this right from even when this discussion was going on. We need to have mitigation plans. So we already know that once these schools open, there will be a spike in the number of cases that we have. So what are the mitigation plans? So if there's an outbreak in a school, for example, what is the plan? What do we do? Are we going to shut down the school again and send everybody home? What are the policies and protocols that need to be adhered to? I mean, there was a report, I believe it was yesterday, one of the schools, the kids were walking around without any masks, and they were being interviewed, and they were asked, why aren't you wearing your mask? And they said, well, no one told us we're supposed to wear masks. So these are the things that some of the things that have not been done while we're rushing to open up schools. So we need to put certain protocols in place and certain mitigation plans in case we have outbreaks in some of these schools.
Of course, the need of the various schools differ, because what you're going to need for those who are leaving primary 6 and those who are leaving JSS3 is quite different from what you're going to need for those in SS3.
Correct.
And yet these are just exit classes we're talking about.
Yes. So that's where a risk assessment comes in. So you need to do a risk assessment of each level, the primary 6 students, the JS3 students, the SS3 students, and then you determine what it is that, what will be their needs. What will they easily comply with? Do you need to have maybe 30% capacity of the class? How many people do you actually need to have in a class? Maybe you need to spread these classes out over a certain number of days. So these are the things that we need to put in place before throwing these kids out. Let's also remember that these kids have teachers that are elderly, have teachers that have underlying conditions. You don't want these teachers to pick up the infection, and you sort of start hearing that, oh, we're losing teachers here and there. So these are the things that need to actually be put in place before we throw these kids back into the schools.
I received a mail earlier in the day asking me to ask you about one particular group of people who are not being talked about yet, but at some point they will have to be talked about. That's those in the smaller grades, those in kindergarten and nursery, who have the same thing in common. They are absolutely uncontrollable in terms of all
Yeah.
these safety protocols. And at some point, we're going to
Yeah.
have to address that. What do you think?
Yeah. Okay, so this is my opinion, and this is the opinion I've held on to since the schools were shut down. Some of those lower classes we can actually hold these kids back till we have vaccines that can properly protect people. Why do I say this? I say this because how are you going to socially distance a 3-year-old? How are you going to socially distance a 5-year-old? They're not going to have any clue what you're talking about. And they may end up having mild disease or asymptomatic infection, but they're going to take that infection. We know in our society, we live in multi-generational households. So you have the kids, the parents, the grandmas, the great-grandmas, every parent living in the same household. So these kids are going to take the infection back home, and then grandma is going to get sick, and then what happens? So I don't believe that holding a 3-year-old back for a few more months till we have a vaccine is going to prevent that child from achieving their full potential in life. And that is my own position.
Thank you so much, Dr. Blossom Madra, for your perspective on all the issues raised in the course of this discussion. It's been a pleasure having you with us on the program.
You're most welcome. Thank you for having me.
Moving outside Nigeria now, with South Africa amongst the global top 5 COVID-affected countries, the World Health Organization is deploying a surge team of 43 experts from various fields to support the COVID-19 outbreak response management in the country. The first 17 health experts arrived today and include key expertise in epidemiology, surveillance, case management, infection, prevention and control, procurement, as well as community mobilization and health education. After the initial quarantine period, the experts will be deployed in the National Department and 5 of the country's 9 provinces where most urgent support is needed. The search team will be jointly led by the WHO Regional Director for Africa, Dr. Matshidiso Moetse, and the Executive Director of the WHO Health Emergencies Program, Dr. Michael Ryan. They will work virtually from Brazzaville in the Republic of Congo and Geneva, Switzerland, respectively, to support the experts on the ground. New York City Mayor Bill de Blasio says plans are underway to introduce quarantine checkpoints at key entrances to the city to screen travelers arriving from parts of the United States with rising numbers of COVID-19 cases. This comes as over 4.7 million people are infected with the virus in the United States, and with the death toll nearing 160,000. Meanwhile, more than 700,000 people around the world are now known to have died from COVID-19.
As there is no end in sight with the COVID-19 spikes across the United States, President Trump provides these updates.
A test positivity rate between 5 and 10%, and in the states with the lowest positivity rates, we also see slight increases in daily cases in a couple of them. We must ensure that these states do not become new flare-ups, so we're watching them very, very closely. Fortunately, thanks to substantial improvements in treatment and the knowledge we have gained about the disease itself, the recent rise in cases has not been accompanied by a significant increase in deaths. Fatalities nationwide are at roughly half the level of the April peak. So the number of deaths or fatalities are at half the level.
Studies are showing that blood plasma could be used to treat COVID-19 and could be life-saving.
Plasma therapy is a new old therapy. We're using it now for COVID-19, but it has been used in the past, and plasma is the liquid portion of the blood. Plasma contains many of the antibodies or immune proteins that are necessary to fight infections. Plasma therapy works because it transfers immunity to patients critically ill with COVID-19 from patients who have recovered from COVID-19. So again, we believe that the plasma has immune proteins called antibodies that help either neutralize the virus or help the immune system recognize the virus as a foreign invader.
we're not able to go and treat patients, but maybe by doing this, we can offer some treatment that'll help some people that are infected.
While the world still waits on a vaccine, blood plasma and other therapy treatments are being used to address COVID-19. U.S. House Democrats and Republicans are still working on negotiating a second stimulus bill to address the needs of Americans. From Washington, Maria Bird, Channel Television News.
Let's talk now to Maria Bird, who joins us from Washington, D.C. Via Skype. Good evening, Maria. Thank you for your time and your reporting.
Good evening.
Let's start from the last point you made in your report, which is this stimulus package. The last time we spoke about this, you did point out that there was some kind of consensus building around the need for this package. Is it now a done deal?
No, at this time, it is unfortunately, I think, the understanding of a need, but the semantics of some of those, as if the $600 unemployment benefits that people were receiving, that is a contentious area of discussion for both the Democrats and Republicans. There are several other issues surrounding evictions and rental rent that people are paying that many people cannot afford to continue paying as a result of losing their jobs. And so, fortunately, many Americans are now having to suffer almost a week into not being able to receive additional benefits that were obviously helping them to be able to ensure that they were able to take care of their basic needs of life.
Does this have anything to do with the politics of it? Because as President Trump keeps trying to emphasize that this is going to go away, and as far as he's concerned, this has just got to go away. Does that have any bearing on the fact that people are finding it difficult to agree, and there are all these, shall we say, side issues that are clouding the main issue?
It does, but I think that I don't think Democrats and Republicans have the viewpoint that necessarily the virus is going to go away. So the number one piece is that there is a need for a second stimulus package. I think most Republicans and most Democrats agree on that factor. The issues are surrounding how much of a benefit and who's going to receive the benefit. So is it business owners that are going to receive benefits? Is it going to be the everyday person who is unemployed that's going to receive the greatest amount of benefits? So it's really about how, and I think their difference is really about how to spare the economy. Republicans are very interested in getting the economy back on track. A lot of people are losing a lot of money. And so that's where their number one interest is. And again, Democrats are looking more at the welfare of the everyday American.
There is a balance to be had on that issue, just that like there's a balance to be had on the issue of reopening and controlling the rise in cases. And that brings me to the issue that you mentioned where one of the doctors was talking about the issue of plasma and all of that. Could you expatiate on that a little?
Yes, well, there are many therapies, obviously, that have been developed and that are being used. Some are more successful than others. One of the therapies that I think has started to become great attention toward is the antibodies and being able to look to see the antibodies of individuals. Do you have the antibodies that potentially could allow you to not have some of the adverse effects of COVID-19? And then if you don't and you've contracted COVID-19, the plasma is, and as we know, this is something that's been used with other diseases in the past, it could be those antibodies from someone that has had COVID-19. That plasma and those antibodies could be used to be able to infuse those into an individual that has COVID-19 as a way to ward off and to fight those COVID-19 virus, those viruses that are within the individual that could be, looking at life or death.
There's still the ongoing battle between the president and the governors over the issue of how much to reopen and how much to keep closed as part of containment measures for COVID-19. How is that playing out?
Yes, well, it's now gone even further, not only the federal level to the actual state level, but within many states, you're having various jurisdictions, whether it's counties having various laws that don't necessarily correlate to where the governors. I mean, as we know, the U.S. has Democrats and Republicans are kind of the driving political parties. And if you have a Republican-run state as the governor, but you might have a county which is run by Democrats. You could have a varied opinion on the reopening process for those specific counties. And so you're seeing very often that counties are deciding to reopen schools virtually, while the governor might believe that the state should reopen physically because there are measures being put in place to be able to ensure social distancing, plexiglass for some of the classrooms to divide the teacher and the students. And again, there's also a social welfare component as well. Many people believe that those who don't have access to the internet, don't have access to computers, tablets to be able to do their virtual schoolwork are going to be left behind. But the real issue is, how do we begin to not leave anyone behind and be able to address some of the systemic issues that obviously COVID-19 is exposing that the U.S. has been dealing with for centuries?
Indeed, that's correct. Thank you very much, Maria, for your report here, and do continue to stay safe out there.
Thank you for having me.
Time for our global update.
The French government has come under fire over its free-for-all COVID-19 testing policies as queues snapped out some testing centers in the capital, Paris, and at sites across the country amid a flare-up in infections. One leading federation of laboratories said an abrupt July 25 decree to make testing free of charge and without prescription piled pressure at the time many staff go on holiday. The country, like its neighbors, is witnessing a mushrooming of new coronavirus clusters. Meanwhile, authorities in Paris are expected to make the wearing of face masks compulsory in certain busy streets and other outdoor places in the city. Over in the UK, lockdown restrictions have been imposed in Aberdeen due to a coronavirus cluster in the city. Restrictions are also expected to be introduced in another city in northern England in the coming days after a rise in COVID-19 cases. The South African government says it is successfully managing the biggest COVID-19 surge on the African continent. The number of infections in the country passed 500,000 last week, a new milestone in the pandemic. The health minister, Wele Mkize, says the government has coped with the surge thus far, despite what he called challenges and glitches. Finally, the daily number of newly confirmed COVID-19 cases in India have exceeded 50,000 for the 7th consecutive day. The Ministry of Health says as many as 52,509 new COVID-19 cases were detected in the past 24 hours.
You can take a closer look at some of the COVID-19 global numbers by logging on to our website, channelstv.com. There you'll get more updates and a better understanding of all you need to do to stay alive and safe. Also look up on COVID-19 cases, figures and numbers of recoveries in Nigeria, Africa, and around the world. You can also find the latest stories, the business, sports, entertainment in Nigeria and across the world. That's our package on COVID-19 update for tonight. Do join us for a fresh package of the program at noon, at 6, and at 9 p.m. Tomorrow. Thank you so very much. I'm Ladi Akere Duluale. Good night.